Hello guys, welcome to my channel. In today's video, we are going to talk about boobs, breast. As we all know, we are in the month of October and it won't be good if Blessing Hills does not bring you a content concerning breast cancer. So, Booktober, yeah, let's dive in. I'm not here alone today. We have a guest, a very special and important person. Let him introduce himself. He's a very big man, actually. Hello, sir.
Hi, Blessing.
Welcome to my channel.
Thank you so much. It's a great pleasure to be on your channel today, and of course, being the guest on your channel. My name is Aka Elijah. I'm a third year medical student at the Far Eastern Federal University here in Vladivostok, Russia. I'm actually from, I think, Nigeria, right?
You think?
Okay, I'm from Nigeria. Yeah, I'm a Niger boy, and yeah, today, like you said, we're going to discuss. Yeah, it's a great pleasure being here.
Okay, thank you, sir, for honoring our invitation. So let's start. Tell us about breast cancer. I mean, what is this breast cancer? Since you're a big man, me today I'm not going to do a lot of talking. He will do them for us because he's a big man now, almost a medical doctor. So,
Oh yeah, so breast cancer is one challenge we are facing currently in our world. Breast cancer is actually a cancer of the breast, just like the name says, breast cancer. And this is when there are abnormal growths in the cells of the breast. And then these growths, if they're not controlled, they keep on expanding, they keep on increasing, and they cause tumors in the breast. And I think breast cancer is actually very prevalent in our day and time. About 60% of cancers majorly like found in women, they are breast cancers, and it's really common, and it's actually a very serious problem. And yeah, that's why we're here today to do an awareness about it and then
sure.
throw more light on it.
Okay, sir, thank you. So, actually, this breast cancer thing is getting serious, and I mean, it's good that they actually put this month aside just for creating awareness on breast cancer. So, now let's look at the causes of breast cancer. I mean, what causes breast cancer?
Okay, so specifically speaking, we cannot actually point to one particular cause of breast cancer. Like we all know about cancer, there are no defined causes of cancer. But I would like to say we have two general factors or causes of cancer. We have the natural factors, and then we have lifestyle factors. So based on the general factors, sometimes it just happens as a result of age. Like when you grow older, you just find it in your system. Yeah, women who are probably in their 50s or early 60s, they get to experience some of these issues. And then sometimes it's as a result of family history. You have a person, maybe your mother, your grandmother, or maybe your aunt or something, they've had it before, and then it gets to flow genetically through your family line, and then it kind of appears or shows up in your life as well. So those are the two factors. And then we still have genetic mutations, where there are some changes in the genetic factors in your genes in your system, and then cancer shows up. And I think the last one is about hormonal imbalance. So that sometimes you find, like for some ladies who actually experience maybe menopause, menstruation starts at an earlier age. So that sometimes they're predisposed to having cancer later on. And then when you have late menopause, these are factors that actually can spring up cancer in people. And then for the lifestyle factors, I'd like to like people who are obese, yeah, they're more predisposed to having cancer. And of course, people that take alcohol, I think it gets to affect it. So, like generally, it's advised that you stay away completely from alcohol. But if you must take, then probably.
Drink
But yeah,
responsibly.
like even a drink per day, I think it's, if you take a drink per day, like for a month, that's still a whole lot. So basically, you have to like stay away from alcohol, from smoking, and all of these issues.
Oh, okay. So if I understood you well, it means we don't have any particular cause that this is what causes breast cancer, but then we have factors that may increase your risk of getting breast cancer, and these are the factors you talked about. Now, let's see, how do I know I have breast cancer or I'm developing it?
Mm-hmm.
How do I check that? The symptoms of breast cancer.
Okay, so for the symptoms of breast cancer, you see, like you cannot ascertain if you have breast cancer just by having some probably mechanical check or like just touching here and there. The best way to confirm if you have cancer is actually a check with your gynecologist or your healthcare provider. But there are some symptoms that you yourself should first know that indicates probably there's some cancerous growth in your breast. One of them, like you have some lumps, and then you can also like notice if you've noticed there's a discharge from your nipples. Yeah, it can actually indicate cancer. And then sometimes we have dimplings of the breast. That's when there's like your a part of your breast, like it kind of goes inward. Yeah, and then like it's uneven. The texture is not even. You feel it, and yeah, you have the changes in breast size or shape. Maybe one you feel that one breast like is bigger than the other, or one is upper than the other. So yeah, these are signs and symptoms that you should notice and note out for. And when you see them, you have to make sure you confirm with your doctor for proper check so you start the treatment early.
Oh, okay, so if I see these changes, it doesn't mean I have breast cancer, but then they are things I should go check as a healthcare provider, or my I should go see my doctor and talk
Yeah,
about it. So
that's
they,
right. Since there are no direct causes to it, so when you see some of these signs, you go for a further check to confirm if you have it or not.
thank you very much, sir. I think we are really learning. I'm learning a lot today. This breast cancer thing, it's a very huge topic on its own, and I love this part, the part we are going into. At this point, there are some common myths, things we say about breast cancer, but they are not true. But then we are going to talk about these myths and then the real fact. So what I'm going to say is what people out there, we out there think, but is it really the case? Yeah, so Sir will give us the facts as I give out the myth. So the first one, Sir, only women can get breast cancer. Is that true?
It's not perfectly true in the sense that reported cases of breast cancer in men as well, though they're really rare and it happens like in very rare circumstances, but it's actually possible for breast cancer to be found in men as well. So it's not just a woman thing, and I think that's why it's important for our men to also like carry this thing on their head and yeah, make more awareness and then get to save both our men and women. Of course, it's more prevalent in women, but it's also very possible to be found in men.
Oh, so now the men are not free. They are also included. We are in this together. I see.
Yeah.
So you see, most guys think that they can never develop breast cancer. So
Mhm.
they are free, and then it's the women thing. But now I think you know that you are also at risk, even though it's rare. You can actually get a breast cancer, but being a woman or a female makes you
More
be at a high
predisposed,
risk.
yeah.
Okay. The second myth is that only older women are at risk for getting breast cancer.
Yeah, you see, like this stuff has gone on for a while now, and yeah, some persons actually believe, just like you said, that only older women are at risk of getting cancer, but that's really not true. Younger women also can get cancer. Like, remember when I said about the causes or stuff that predispose one to getting cancer? Sometimes when you have early menstruation and all of this, maybe genetic factors. I have a friend actually, she told me that it's something running in their family. I think her mom has it, her grandmother has it, and her aunt also has like breast cancer. So the doctor advised her to check up with her doctor every year because it can set in at any time. So yeah, she has to check in with her doctor and then take some precautionary measures to preventing it. Or whenever it comes, she'll start early treatment. So she's actually young, but she has to take all of these measures, checking with her doctor every year. So it can actually affect younger women as well. And of course, it affects the older women more, but it's very possible in the younger women too.
Oh, so actually, as young as I am, I'm also at risk. I can get breast cancer. So you see why you, the young lady there, should take this awareness serious and talk and speak against breast cancer. I mean, if you've seen an old lady getting breast cancer, it doesn't mean you are free or you are safe. You can also develop breast cancer. That's why we need to take very good care of our boobs. Yeah. Sir, finding a lump in your breast means you have breast cancer?
That's actually not true. I mean, there's some guys who have probably tried to feel it once in a while, and if they're quite sincere, they might have noticed that sometimes you feel a lump or something.
So wait, are you talking from experience or you're putting it on
No,
guys?
no, we're speaking medically, right?
Okay.
So we're speaking medically. So actually, when you're even carrying out the like a personal self-examination
Mm-hmm.
test for yourself, it's advised not to like just squeeze or something. Like you rub it smoothly, and then that's where you get to feel the real cancer lump if it's there. But if you actually like squeeze your breast, like hold it and then try to like grab it between your thumb and your fingers, you'd actually feel a kind of lump there. So the presence of a lump in your breast does not always indicate that you have cancer, but yeah, like if you actually carry the true process, like you do it correctly and you feel a lump, then it should go for a medical check to confirm if it's actually cancer or not.
Oh, okay, so some of the lumps in the breast are not
They're not
cancerous.
cancerous, yeah.
Oh, okay, I see. I'm learning, guys. I mean, I hope you are learning too. Okay, sir. Wearing an underwear bra can cause breast cancer, which I'm wearing one.
Yeah, don't be afraid. Yeah, actually, I don't think, medically speaking, based on facts, it's actually just a myth. So, based on true facts, there's no scientific link, there's no bridge between underwear
Bra.
bra and then breast cancer. So, I don't
Okay,
think they
so
have any connection.
please, you're free to wear your braces. It's not going to give you any breast cancer. Um, the only women with a family history of breast cancer are at risk. So mean that my mom doesn't have, my grandmother, no one in my family having breast cancer. I'm free. Is that the fact?
Well, sad as it may seem, I would like to say that something always starts from someone. So, for example, for those who claim that they don't have it in their family history, even those who have it in their family history, it once started from somebody for it to have flowed through. So it can start from anybody. Anybody can be the
So I
originator.
can be the first.
You can be the first to transmit it to your future generation. The point I'm trying to make is this: that in as much as one doesn't have it in a family history, it's very possible to start at any point. And yeah, it's not just about those who have it. Oh, my grandmother had it, my mom had it, and all of that. So it can start in anybody, and we all need to take proper care of ourselves, to check up always, and then to take precautionary measures because we can actually it can develop in anyone. Yeah.
Actually, the women who are diagnosed with breast cancer, most of them do not have any family history. So, as you said, they are the first to send the history.
Yeah,
So, yeah, you
the
should
pacemakers.
take care of your breast regardless whether you have the family history or not. Here we have that if you have a family history
Mhm.
of breast cancer, then you are going to get it.
Oh,
So, what about that one?
yeah, that's still another myth actually, because someone has had it in your family line doesn't necessarily mean you're going to have it. Of course, it predisposes you to higher factors like higher chances of getting it, but it's not a guarantee that you're also going to be a victim, or you're also going not a victim actually. You're also going to like
Get
suffer
it.
from this disease. But of course, like what you know, you take proper action on like your what you know. So when you have knowledge of the fact that your family members have once had this, you now know okay what to take, and then you seek early advice, you seek early treatment, and you seek early diagnosis in cases any of such. You now begin to treat it earlier to have a general health, like better health.
Okay, so you don't have to kill yourself if you've come to hear that maybe someone in your family has ever got breast cancer. It doesn't mean you are going to get it. You just have to, I mean, protect yourself and take good care of yourself. And
Mm-hmm.
before you know it, you won't even develop it. Sir, this is a very interesting myth. Small-breasted women have a lower risk of developing breast cancer. In fact, most of them think that now breast cancer is for people with big boobs, like not for us with small boobs. But so
For
I
what?
mean, I mean,
It's for us.
yeah, we those with small boobs, we think that those who have bigger boobs, they are the ones at risk. I mean, Oh,
Okay, yeah, so I think basically, just like you said, right, we have the small boobs and we have the
we have the small boobs and
nah,
the
we have the small boobs and we have okay, yeah. So there's no scientific connection between the size of boobs, the size of breast, and breast cancer. It's not actually about the size. It can happen in anyone, and the size does not play any direct role in one having breast cancer or not. Yeah, that's some older women who doesn't really have like big boobs, so yeah, but they're affected by this. So it's not really a thing of size. So you could have big size, you could have
no,
small
the big
size.
one. Why are you pointing the big at me?
You could have big size, you could have small size, but yeah, it can be found in anyone. It's not a thing of size. Yeah,
Okay, so whether big, small, large, or whatever, we are
medium.
all in this, or medium, we are in this together. So take care of your breast. Um, breast cancer is contagious.
That's not true. So it's not an infectious disease, so it cannot be passed from like directly through contact from one person to the other. So it's not contagious. You cannot get it from somebody by maybe sharing drinks together, drinking from the same cup, even sleeping together. I mean, like you sleep, like I mean, sleep.
Sleeping
I mean,
together.
sleep, like when you share the same bed and all of that.
You're sharing bed, sleeping together. You are safe. You won't. It
Yeah, you're
won't
not going
be
to. Yeah, it's not going
okay.
to. So
So
probably have a sister, and then because she has breast cancer, you're not trying to stay away from her. Like, oh, don't touch my stuff, don't use this. Like, I think that's actually discrimination, and it's traumatic to think about it. So it's not actually going to. It's not contagious, and it's not passed directly from one person to the other through contact.
okay, so I think this is very, very important. It says something. You see, some of us are very discriminative. Like when it comes to people that have maybe a certain, not even like breast cancer, but most diseases out there are not contagious. But once we hear that this person has this particular disease, then we try to just stay away from them. We don't even want to talk with them. I mean, breast cancer is not contagious. You can eat with the person, drink, do everything. As you said, you can even sleep with the person. I mean, on the same bed, maybe your sister and yeah, but you won't get breast cancer.
And
It,
yeah, just sorry for cutting. Just to add again, like for something that someone hasn't caused directly, just imagine like you're just growing up and all of a sudden like you got diagnosed of breast cancer and you're getting to suffer for it, like your family is even staying away from you, your friends are discriminating against you and all of that. I think it's even worse than the breast cancer
the
itself
disease
because yeah, like
itself.
you just got to find yourself in this and then it's really sad. So
It,
it's
it,
we should say no to
yeah,
discrimination.
yeah. It's at
Yeah.
this point you have to bring the person closer to you and make sure they are okay, they feel good and normal. I mean, they really need you. I mean, those who have the cancer already, they didn't cause it. It's a it just happened.
Mhm.
So you have to bring them closer and make sure you encourage them that that's not all. I mean, life does not end at that point. There are still more to life than getting
Breast
breast
cancer.
cancer. Yeah.
Yeah.
So having an injury or trauma to the breast can cause breast cancer.
Okay, so physical injury or trauma on the breast does not directly cause cancer because a cancer, like you know, these are abnormal growths right from the cells. So an external injury on the breast does not directly cause cancer, does not affect the breast. But of course, like when you have an injury still, you should not just because it doesn't cause cancer, you just leave it like untreated or something. You have to still seek proper health care to make sure that other opportunistic diseases doesn't take advantage of the fact and then get to affect your breast. So yeah.
Okay. Using deodorant or antiperspirant after shaving increases the risk of breast cancer. I think I need to hear more about this. Is it true? I mean, after bathing, I'm using my deodorant or something. Is it going to cause breast cancer?
Okay. Actually, there are claims that some creams have some chemicals in them that are carcinogenic that are able to like cause skin cancer. But for deodorants and like some of our perfumes, I really don't think they possess those carcinogenic chemicals. So it's really fine. Like we have to take proper care of our body. We have to smell good. We have to look nice and all of that. So we shouldn't use maybe the fear of breast cancer as an excuse to go about with body odor and all of those things. Yeah, like you have to take good care of your body.
Okay, so deodorant or antiperspirant use does not increase the risk of breast cancer. Breast cancer is always accompanied by a visible lump.
Okay, so there are even some persons, right, that may be asymptomatic, that they don't even have any sign at all. There's no lump, there's no redness, there's no discharge, but breast cancer is there. So the presence of lump does not always guarantee that there's breast cancer, but of course we have to always check up, we have to confirm exactly what it is. It's our body, and we need to love ourselves, we need to take proper care of our body. So whenever you notice any lump, whenever you notice any, then you have to check up. Lump in the breast, it's not a guarantee that there's breast cancer.
Okay, so it's not always about the lump. Sometimes you see pain, you feel some pain, some nipple changes,
Yeah.
and some abnormalities. You should really take them into consideration.
Yeah, and
Like,
then yeah, just to add again, for those who are probably around 35 years and above, like without these signs, without these symptoms, it's advised that you still check up on your with your gynecologist every year. Just like you've not noticed anything, but you still have to go. Like just it's for
to
your
be
health.
sure you're
Yeah, to be
safe.
sure you're still safe because sometimes it may start and then there are no signs and no symptoms.
So, if you have had one breast removed
Mm-hmm.
due to cancer,
Mm-hmm.
the cancer cannot develop in the remaining breast. I mean, I already had breast cancer and they removed one. I mean, I think I'm free now. No, I can't get the cancer again. Or
Even though one has suffered from cancer, it doesn't mean the other is directly going to have cancer as well, and it doesn't mean it's not going to have cancer. I don't know if you got it. So, for example, you've once had cancer maybe with your left breast, and then you maybe it was cut off, mastectomy, and then you're like, okay, now that it's cut off, I'm never going to have cancer again. I'm never going to have breast cancer. It doesn't directly mean because one breast was cut off for cancer, you're not going to have it. And it still doesn't mean that because one breast was cut off because of cancer, you're going to probably have uh, breast cancer on the other remaining, yeah,
the one we are managing.
yeah, the one we're managing for now. So it doesn't directly mean you're going to have or you're not going to have.
So the fact that you got one breast removed due to breast cancer does not mean you shouldn't take care of the other breast. You
Mhm.
can still develop it. And the fact that if they got the other one removed does not mean this one is going to get. So I think the myths are a lot, but we can't talk about all. So we will quickly move to how we can prevent breast cancer.
Okay, yeah. So before I talk about preventing the breast cancer, I think I'd just like to add one myth. Sometimes it gets to find its way amongst, especially the young people. Things like sucking the breast gets to prevent breast cancer. So actually, that's true, and it's still not completely true. True in the sense that, for example, for breastfeeding mothers, when you give like your babies breast milk,
Babies,
yeah,
I mean kids, babies, 6 months old, like
not the
zero
adult
to
babies, because I think there are two classes of babies: the little babies and the real babies and the artificial babies, right?
Oh, you mean I don't know.
Yeah,
I
so
only know the babies,
yeah, we're
the
talking
kids.
about the real babies. So like when you give them, it helps to because the estrogen is functioning and it's producing more milk for the babies to suck. So it actually helps to reduce the chances of getting breast cancer. So for mothers, it's actually nice and good. So you shouldn't hold like withdraw yourself from breastfeeding your babies. So yeah, I think it plays a great role in helping to reduce breast cancer in women. And somehow I think that's where the other artificial babies, the
The big
adult
men.
babies, to say, okay, they want to help their wives, like maybe the kids, the little babies are not doing the job well enough, so they want to help or something. And yeah, sometimes for those who don't even have babies, like you see artificial adults helping, all of that.
I
But
think
yeah,
that one is maybe helping to find
the
maybe
lump,
yeah, a lump or something, but not really. I mean, the adult people is not for actually preventing it. Maybe you are helping in finding the lump
yeah,
because if you have a wife and I mean you usually do that It means that when you now notice a different lump in the breast, like you could
Yeah,
talk about
that's
it
if
and
he's
go to the.
that's if he's not too deep into the pleasure that he actually forgets to take note of some things. Yeah, because there's sometimes like what you should have noticed because you were like
Are lost
your
in the
mind.
forest.
Yeah, but I think yeah, truly it can help.
Okay, thank you,
Okay,
sir.
yeah, so now talking about the prevention, first you have to do self-examination. You have to check up on yourself once in a while. Probably for those who have experienced like menopause already, you can check up anytime, just fix a particular day in the week, and then you check up maybe monthly, and then of course you take clinical breast exams. These are like definite ways and measures to actually confirm if you're safe or you have breast cancer. And then yeah, like when you go for the clinical checkup, we have several tests. There's mammography where like they use MRI, like imaging and all of that to actually see if there are these factors. And then you maintain a healthy weight, and then you carry out physical like regular activity, physical activity. You work out, and then you actually limit your alcohol consumption as well. Like you watch your diet, what you eat, and all of those things. I think it helps to make us like generally safe, and it helps to prevent the occurrence of breast cancer in women and men, of course.
Yeah, I don't like it when you put it on the women because men, you are also part. Okay, you should also know your family history just to be on point. I mean, to be on course. Check your breast from time to time, as if someone has ever gotten your family. You know you are at high risk of getting the breast cancer, so you visit the hospital most of the times to make sure you are safe.
Yeah, in the words of Jesus, he said something like, "If you know the truth shall set you free." So when you actually know like the true state of things, what has really happened, like when you know the truth, you are now like, and then you act on that truth, it will now set you free. So when you know your family history, you act on it, you will now help to prevent yourself from,
From getting it.
yeah.
Yeah, we've talked a lot, but then all these that we've talked about, the main important thing is to always visit the hospital. I mean, go to your gynecologist to check from time to time. And then the self examination too, you have to do, you are doing that to check out differences. I mean, if you put a day for every month, every month you check for differences, what you didn't see the previous month. And if you find anything like that, you quickly rush to your gynecologist to discuss and check what exactly it is, because early detection is actually the key. I
Mm-hmm.
mean, if you detect it early, it's not going to cause any big harm. And also, if you are unfortunate to have detected it late, that's not the end of life. There are a lot of ways to go about it. So, guys, let's be guided. Let's protect ourselves.
Yeah, I just to cut in again, I think basically what Blessing said, like she has covered everything we discussed today. All we're doing is an awareness. We're getting to let you know that breast cancer is real, it exists, and it can happen in anybody. So you have to take your health seriously, and you have to be aware, and then you have to always check up with your doctor. Yeah, we're actually still in the process, right? We're not health experts yet, so you always have to check up with your doctor, your gynecologist, your healthcare provider to make sure you're on the right side and yeah, stay safe out there.
Yes, I like that. Thank you so much for coming. In fact, Tim Hughes is very happy and glad to have hosted you.
Thank you so much. The pleasure is mine. I'm really glad to be here.
Thank you.
Thank you.
Guys, so this is the end of today's video. Don't forget to like, comment, and share. Also subscribe if you haven't. Thanks for watching and see you in my next video. Don't forget I love you all.